This rhinoplasty video is talking about the male patient, M-A-L-E, so male patient. It is a complicated concept because the majority of traditional rhinoplasty was geared to the woman. Now, why was it geared to the woman? Because in our society, historically, we've always prized female beauty more than male beauty. But in the last, I would say, 20, 30 years, male beauty has become much more a component of what we assume to be, we see male models, and so it's not just in the world of women. But if you look at traditional websites, you think about traditional concepts, all the rhinoplasties that were performed many, many years ago was really geared toward women, and men were just ignored. And so I do a lot of male rhinoplasty. I want to talk about what makes a good male rhinoplasty, but I encourage you to watch, if you're ethnic, to watch the ethnic rhinoplasty video. If you're Hispanic, to watch the Hispanic one, the Asian one, the Middle Eastern one, or whatever is applicable for you beyond this video. But I want to talk about general concepts of male rhinoplasty. So what's interesting is sometimes a very large male nose can actually be very masculine. And so if you over-reduce a nose and try to make it perfect and fine and small, you actually may demasculinize or make a nose not as masculine appearance. So this is one of those conversations I have with you. It has a lot to do with sort of your social position, thought, etc. For example, if you have an aging nose, which is another topic, but if your nose is sagging down and you're in a competitive work environment, I need to make your nose not look so sagging. So that's a component. And this is if you are gay or a more feminine nature and your sensibility is more feminine, then I may make the nose a little bit finer and not as prominent. So this is a huge conversation that I have with you, is that if you're saying, no, I really want to maintain my masculinity, sometimes I even leave a little hump there. And you say, well, when would you leave the hump? That's a conversation. We do a 3D imaging. I go through with you. How much refinement are you looking for? Some men just don't think their nose fits their face because it's too large. And it just is a distraction. When you're having a conversation with them, all you see is this nose. But they say, Dr. Lamb, keep a little hump for me. Or, I don't like the hump. I want a straight bridge, but keep my bridge really high. Or sometimes their tip doesn't match their bridge. I've got to reduce the bridge a little bit lower to match the tip, or I've got to make the bridge a little higher. All of those subtleties when it comes to male rhinoplasty are the things I specialize in a conversation I have with a male patient. One thing that's very interesting is that the older heterosexual male, let's say 45, 55, 65, they oftentimes cannot tolerate as much of a change to their nasal shape. So I may talk about a more conservative rhinoplasty for that person. The reason I say heterosexual is that gay men, sometimes who are more feminine in nature, are actually okay with a greater degree of change. And this is that whole conversation. I'm not trying to pry into your orientation or pry into your private life. I'm really trying to get a sense of who you are. It helps me understand what I need to do, and it helps me direct that conversation in a way that will be geared to you so that I can really suitably make the nose as perfect as possible for you and what you want. Now, sometimes if you hear this thing, you're a 55-year-old heterosexual male, maybe you just have a problem because you had an over-reduced rhinoplasty in your 20s. And you should watch my video on revision rhinoplasty along with just my general rhinoplasty video. There are so many elements of this. A traumatic nose, where the nose you can't breathe, and the major issue is you just can't breathe, but you never liked your hump, you want that reduced. The point of this introductory video is not to cover every topic in male rhinoplasty, but to cover the salient points, to have you understand some of the psychosocial framework, some of the general principles that I follow, that I think about, and during that conversation with the consultation, it'll give you some framing elements before you meet me if you haven't already.